Welcome. My name is Corinne Waldow. I'm the Economic Development Director for the Boulder Chamber. And I want to, again, welcome you to the office hours. Sounds fun to say, for our sessions to help you save for reopening. I want to thank all our public health, and I want to thank the other chambers and economic development agencies for helping us get the word out to businesses to help you reopen more safely. We will be taking questions through the Q&A feature, but we'll be also asking you questions about social distancing and mask usage. At this time, I'm going to pass it off to Zach Swank with Boulder County Public Health.
Thanks, Corinne, and thanks to the Boulder Chamber as well as our other chambers and economic partners for continuing to support these webinars. Today, we're going to do a quick recap of the face covering orders, safer at home, talk a little bit about timeline coming up, what resources are available to support you, and then as always, we're here for your Q&A. Please do use the Q&A feature throughout this presentation to submit your questions. So timeline, everyone knows we're under safer at home. I think we're familiar with that. We've got the county's face covering order. Louisville, Lafayette, Superior, others have local face covering orders as well. We'll talk a little bit about that. But we're all looking forward to May 25th when the governor has forecasted updates and decisions on spring skiing, restaurants, and summer camps, as well as he's expressed indication that after June 1st, there'll be further updates to the order. But long term, it's important to remember that until we have a vaccine, treatment, or herd immunity, we will need to continue to have some precautions in place. And for example of how long this might be, with regards to herd immunity, I read in the news that Colorado, they estimate about 3% of Colorado's population has contracted COVID at this point, and that we would need that to be 70% before we had herd immunity. So you can, take a look at, the 2-3 months that we've had community spread here in Colorado, and then how long it would take to get to 70%. It's going to be a while, and we're going to continue to be under safer at home or some version of some restrictions for quite some time. So as some friendly reminders, COVID-19 is still just as contagious today as it was back in February and March. The success that we've seen with the reduction in transmissions is not because the virus has changed, but because we've been good about social distancing and staying at home and wearing face coverings. And so we need to continue to do those things as much as possible. Under the safer at home requirements, offices are allowed to have 50% of their workforce return. If you don't need to do that, if you can still continue to have your staff work from home, that is absolutely the best practice, and it allows us to continue to further loosen restrictions. The better we are about maintaining those best practices. But the good news is that our efforts appear to be working. You can see the data of the 5-day average of new cases here in Boulder County, that we are now trending in the right direction. And I looked at an update of the data today, and it's still continuing to move in that positive direction. But there's two things I want to highlight about this data and about this disease related to this data. One is that because of the incubation period of 14 days, it takes us 14 days after we make a change to know, what happened on the day that we made that change. And then, of course, say restaurants are able to open on, let's say June 1st. So that means June 15th would be the first day we begin to know what the impact of that policy change was. And, that's only one day's change, right? Only counts for the first. So really we need a week of restaurants being open and then 2 more weeks to then find out, what level of transmission was happening as those restaurants were operating under those new restrictions. So that's one point. And then the other point is that, though this data is positive, and it looks like we're doing a decent job controlling the spread of COVID-19 in Boulder County, unlike other disasters, that does not mean that we can, go back to normal. If you compare this to, say, a flood, or when the rain stops, when the precipitation, if this was a chart of precipitation and it was continuing to trend down, we'd say, phew, okay, that's over, we can go back. But the thing that's different about COVID is that it's still just as contagious. And if we, look at this data and say, oh, I don't need to worry about it, I'm going to be a little more lax with my behavior, or, with my business, then this is just going to ramp right back up. The COVID is kind of there, and it'll easily start, escalating a number of cases if we change our behavior. So it's good to see this positive data. We thank the community for their efforts in helping to make this happen, but that does not mean that we can relax about it. And with that, I'm going to turn it over to my colleague, Matt Hannon, who is the lead liaison for Boulder County Public Health for the office-based business sector.
Great, thank you, Zach. Good afternoon, everybody. As Zach mentioned, my name is Matt. I am the liaison for the office-based businesses, and so I'll quickly go through a little bit about office sector, and obviously no new updates over the past week or two, but I know that a few of you are new on the call here and haven't been on one of these office sessions before. So I'm going to quickly on this slide just go through some basic guidance from both the state and the county, and I'll show you a few resources as well that'll be really beneficial as you head back to work in your office environments. So things that you should be continuing if you haven't done this already is this 50% max capacity. That's kind of the big one for offices. If you have a 100-person office, 50 people at most can go back to work in that office. Ideally, it would be less than that. So 20, 30, 40%, and continue to have folks work at home. Hopefully a lot of people have kind of gotten into that work at home mentality over the last couple of months and become more efficient. But as long as your office is at less than 50% max capacity, then you're doing okay. Good signage, that would be having signs up around the office reminding people of mask wearing, hand washing, those types of things. We have signs available as well. Reminders, that kind of references maybe reminder emails you could send weekly just to keep people aware that we're obviously still in a very testing time right now with the virus. So they need to continue to clean their office spaces, wash their hands, keep social distancing. Cleaning is the other big one. There's not really a set guidance for how often an office should be cleaned. If you cleaned your office, say once a day after everybody left and had the cleaning crew come in, you should probably be cleaning it more like 2 or 3 times a day now. So maybe a morning cleaning, a lunchtime, and then after work, and really concentrating on those high touch surfaces. So that could be, the break room, fridge, printers and copiers, doorknobs, that kind of thing. Checklists as well, are doing temperature checks, I should say, first. So that could be, if you have an office of 25 or more employees, you're taking their temperature before they get into the office every day. Or smaller offices, you can also do self-checks at home, and they can report then into the office. And the checklists, and I'll actually have a great office-based checklist, as well as a whole sector-based checklist that I'll show a little bit too in just a minute. Having a coordinator is also a really good idea. It's not necessarily mandatory, but having that point person, so an office manager, somebody in HR, or really a volunteer that takes it upon themselves to make sure that those signs are up, that reminders are being sent, that people are keeping social distancing, is really important to have. That coordinator would also be the one collecting that temperature check data in the mornings to make sure that nobody's coming in with any type of flu-like symptoms. Then mask use and social distancing, whether it's your office, whether it's going out on a busy hiking trail, going to the grocery store, mask use and social distancing is required now throughout the county, throughout the state. And so, yeah, obviously making sure that you're still using your masks and keeping a social distance well in the office is important. And then outdoor and online meetings. Obviously not crowding a meeting room would be a good idea right now. It's beautiful weather. Today is absolutely gorgeous out. So, and I think a lot of employees would appreciate having the occasional meeting outside by the picnic bench. So if you can do that, or have your Zoom, your Skype, your Microsoft Teams meetings online, that would be really good as well. One thing I didn't mention here is doors. Some offices have chosen to keep their doors locked to people not in the office. I think that's a great practice so that you don't have people coming and going, and you really minimize those high touch surfaces. And if you have a door, ideally prop it open and keep the ventilation going, keep your windows open as well, keep the ventilation going throughout the office just to get some airflow in there. If you have two doors heading into your office, it's great to prop them open and keep one as an entrance door and one as an exit. That way you don't have people kind of coming and going and having those situations where you have people within a couple of feet of each other. So a couple of common questions and answer that I thought I'd quickly review. That 50% max capacity I mentioned does apply to all office sizes. So an office of 200 can have a max of 100 people in there. If you're an office of only 10 people, you can have up to 5 in there. But ideally, you'll still be well less than that 50% capacity, just to really make sure that social distancing is taking place. Homemade masks, are those okay in the office? Yep, those are fine. You really shouldn't have medical grade masks in the office. They're not really necessary. Kind of keep those for those medical professionals that need them. So if you have something that you made with your family, or some kind of just cloth bandana, those are fine to wear. Essential versus non-essential businesses doesn't really matter anymore. Once the stay-at-home order ended or expired, and the safer at home took over, then all businesses, office-based businesses, can be open. And you do not need to allow any high-risk individuals back into the office. So if you have someone that wants to get back to work, but they might have some pre-existing health conditions, or in a slightly older age bracket, then you can have them work from home, because they could be a risk. Obviously not just to themselves coming to the office, but to others there as well. I thought I mentioned outbreaks as well. So the definition of an outbreak at any business, whether it's office, retail, the food and beverage industry, is 2 or more confirmed or suspected cases in a 14-day period. And so there's a outbreak report form from the Colorado Department of Public Health and Environment, CDPHE, that I'll show you in just a couple of minutes. And if that does occur at your office, you should fill out that form and send it to covidbiz@bouldercounty.org. We, and the number 2 point, we as Boulder County Public Health will pass that on to our team of epidemiologists, and they will follow up with you with the best next steps given your specific situation. So that could be contact tracing, and then figure out what the next best steps might be. This is a bit of an overwhelming slide, and it's meant to be that way. You'll see that third to bottom bullet point on the right is our safer at home checklist for office-based businesses. But I'm about to show you a couple of websites that have a ton of great information, including the checklist, but also everything from cleaning guidance to PPE, personal protective equipment resources, special event guidance, and there's really a wealth of information. And that website you see on the bottom there, boco.org/COVID-19business. I'll be showing it a couple more times, but that's one you might want to bookmark, as that's the county website that really covers every industry, including office-based businesses, and has just a plethora of great resources available. So a resource spotlight, I'm going to kind of highlight these two and take you to these pages in just a moment. But as I mentioned, the CDPHE is the state. When I refer to CDPHE, it's the state's public health department. And so their guidance is that website, covid19.colorado.gov, is the main website, and the rest of that link there is just kind of the office-based businesses that I'll show in a minute. And that Boulder County guidance, boco.org/COVID-19business, is a great resource. And while we're there, let's stop sharing there and head over to those websites. So this first one here is the CDPHE website, and you'll go here, see covid19.colorado.gov. And there's a lot of different ways to maneuver around the website, but if you click it safer at home right at the top, and scroll down, and along this left side, it'll pop up a bunch of different sectors here. So we'll look at the office-based businesses. And a lot of what I just mentioned before about your restrictions, workplaces that, 6 feet between desks and workspaces is a good idea, modifying the flow with doors, office cleaning, all kinds of really great resources on here. And so I'd suggest, if you haven't already, to go to this website and just browse a little bit. Obviously, if you have customers as well, if they're applicable, then you can, there's a bit of guidance there as well with them. Next up, we'll head to the county website that I mentioned. So you just scroll down this, and we just, the updates and the public health orders will kind of be first and foremost on here. Returning to work, a couple of healthcare provider options, and go down just a little bit further, you get to the Boulder County guidance and tools. So here's where you saw a lot of those bullet points from my slide just a minute ago. You keep scrolling down, here's these checklists. So you have a number of checklists. Obviously, as an office-based business, you might be overlapping too with manufacturing, healthcare industry, food and beverage. So we'll just click on this Safe at Home checklist for businesses. And you'll see it's including but not limited to every type of office-based business. And this is a great thing to have handy and to really post up around the office and make sure that everyone knows what the workplace requirements are. That could be signage and proper ventilation, proper cleaning, a couple employee-related requirements, and best practices. And at the bottom of that, there's also some great guidelines here through the CDC and CDPHE that are really great to peruse. With that, I thought I'd quickly show you too that outbreak report form that I mentioned previously. So this is that form through the CDPHE website. And so this is what you'll, the first page is really just some great information about how to use the form. Obviously you fill out the form and then you can send it to the address that I had listed previously, and we'll get that to our team of epidemiologists. And I thought, since I have the internet up here, I might just show you a good resource here too, energizecolorado.com for your personal protective equipment and supplies. It's a great, really just kind of a database for where you can purchase, things like masks and gloves. So with that, I think we'll head back into our normal presentation here. All right, and so with that, I should just mention as well that Boulder County Public Health can provide legal advice. I know there's been a lot of gray areas, a lot of questions about, can I do this? Can I do that legally? What does this fall under in terms of an order? So compliance with all state, county, and municipal or town or city orders is required. But the requirements, as I'm sure you've seen over the last month or two, are frequently changing. And that's obviously dependent on the data that we get back in terms of what the virus is doing regarding hospitalizations and cases and deaths. So it's a good idea to continue to check that CDPHE state website as well as ours, because requirements are changing. And as Zach mentioned, that May 25th date as well, we plan on seeing some new guidance coming then. So next week could look a little bit different, especially when you're looking at maybe that food and beverage industry and a couple of others heading into the summer. Our main role here at Boulder County Public Health is to support the businesses, to educate them, to provide them with any guidance that we possibly can, to make it easy and understandable. Obviously, there's a lot of different orders and guidance coming from all kinds of different agencies, whether it's state or county or local. So we're going to do what we can to help clarify that. Additional questions, though, when it comes to the legal side of things, should be addressed to an attorney, as Boulder County Public Health cannot provide that legal advice. So those two websites I mentioned before really are your two good go-to websites, boco.org/COVID-19business, as well as covid19.colorado.gov. But obviously, the Boulder Chamber has been a fantastic partner, as are your other local chambers of commerce if you're in Longmont or Louisville or Superior, any of those other towns or cities around the county. Small business development centers, industry associations, licensing agencies, as well as your respective towns or cities should also have a lot of information that could be pretty valuable. So right now, as you can see on the right here, under Thursday, 4 p.m., you are office, you read the office hour, as Corinne mentioned, and Tuesdays and Thursdays, no, offices do have a lot of overlap with other industries as well. So these will be reoccurring office hour sessions for the next 3 weeks. I believe our last one currently is scheduled for June 11th, which would be a few weeks from today. But if you're interested in attending any of these other Tuesday afternoon sessions, we have the food service, field services, limited healthcare and personal services. And then Thursday afternoons is manufacturing, retail, hospitality, and of course, office sessions. Wednesday evenings at 6 p.m. are also weekly Spanish sessions. If you have any Spanish speakers that would like to register, they can go to the Latino Chamber's website and do so. Any questions, comments, suggestions? We're happy to see, we're happy to see covidbiz@bouldercounty.org is where you can send those questions. And then we have a call center that actually recently just updated its hours from 9 to 5, Monday to Friday. And there's the number right there, 720-776-0822. And we have a couple discussion questions as well that I think I'll pass over to Corinne from here. So we can do a little bit of polling, because we have a couple questions here. And obviously some of these questions are general for retail or other industries. So when you see the word, like what % of customers do you see? Obviously as an office environment, you might not be having customers come in. So you can take that to mean, you know, what % of employees or maybe customers if applicable to your business.
We've said in the past vendors too, if you have the FedEx person or somebody else coming to your into your office, that can also apply. So I'm going to launch the first poll and then we'll get to your questions. So poll, first one. In the last 24 hours, what % of customers do you estimate wore a face covering while patronizing your business? So you can answer that. So a little bit about a question about the data and the face covering order and data related to the face covering order. Could you share research or decision factors that went into coming up with the 12 years of age with face coverings being required? How does that compare to the CDC's recommendation of age 3?
Yeah, so that's not a number that we came up with. That's a number that was passed down from CDC or the CDPH as an age that I think they felt was appropriate from a medical standpoint. And I should mention too, a lot of the guidance that you're receiving from Boulder County Public Health, we are taking directly from the state. I say a lot when it's pretty much all of it, a vast majority of it. So that's a number that would be coming from the state or federal guidelines.
So Matt and I weren't involved in that decision. So we'll have to ask our colleagues who were and get back to you about that, because I don't know. I mean, and neither does Matt. It was not something we were a part of.
But there are several different mask orders out there. So it's going to be the strictest one that you're going to apply the strictest one. And some of the industries say professional service or personal services, like if you go get your hair cut, they're going to have a little bit different of a requirement as well, correct?
Correct, yeah. So if you're looking at service industries where you're going to get your hair cut, a lot of these industries is really difficult to keep that social distance. So this webinar is specifically for that office environment where it's expected that you don't need to come into close contact with folks. A lot of people are in their own offices. In that case, you're not within 6 feet of somebody. You're sitting in your office for an hour by yourself. You don't need to be wearing a face mask. But the guidelines do state that if you're ever going to be, out in public within 6 feet of somebody, then you should have that face covering on. So you will see, obviously, you go to the grocery store, just about everybody, except for if they have like a medical condition or they're, a young child, will be wearing their face masks.
So I think because the question was about youth, while this is the office webinar, I think that they're just letting people know that there are cases in which a youth does have to wear a face mask, depending on which is the strictest order. All right, I'm going to close this poll. We had some, good participation in face masks, and then, a couple not so good participation with face masks. So while we're doing that, I've already gotten some emails saying, May 26th, Safer at Home, it's ending. What is Safer at Home ending, and what is really happening in the next couple days?
So yeah, don't bet on May 26th as being that date that you can circle and just life goes back to normal, kind of like that. This is, as Zach mentioned, this is going to be with us for a long time, not days, not weeks, definitely into that months range. So we hope to get just simply more guidance starting on May 25th from Governor Polis heading forwards about a number of industries. But you should plan on kind of continuing this safer at home phase that we're in for the foreseeable future. A week from now at our next office session on the 28th, I hope to have a little bit more clarity in terms of exactly what that means and if there will be some type of shift to a different order or different mode that people can be in. But for the foreseeable future, certainly plan on the safer at home kind of being the norm for the time being.
Right. I'm going to launch the next poll. The next one is, how would you rate customer behavior at maintaining at least 6 feet physical distance from other customers and staff? And this might be about staff as well. When you see people talking, are they maintaining that 6 feet social distancing and so forth? I'm launching that poll.
And I would just thank everybody for giving this feedback through these polls to us. We have a Board of Health meeting tonight where we will be making a decision about extending our face covering order or not. And so this information helps evaluate the effectiveness of that order in preventing the spread of COVID. So thanks for this feedback.
Right. All right. I'm going to move on to the next question. The next question is around what is most stressful, if anything, for your staff about the face covering and physical distance requirements?
So you're asking our staff from
No, that's the next poll question.
Oh.
So I'm asking, what's the most stressful thing for staff? Matt, you can answer it too if you'd like.
Yeah.
You can do multiple choices on this one. So if you have more than one, if it's finding supplies, if it's fear of getting sick, we get a lot of communicating to employees how to wear proper face coverings. And Zach provided a great resource today, which is a video from National Jewish that we're going to send to you you could share on proper usage of face coverings. Yeah, and then there's the other category, which we can't capture in this type of poll. Do we have any more questions? We had a question about the call center number, so that is something that will go out. And Matt, could you move back to that call center slide?
Yeah, certainly.
So thank you to Zach for providing the number to everybody on the for that person in particular. I'm so tongue-tied for this session. That person in particular, but for everybody, that is a call center that you can call to ask questions, get some of those resources. All right, so again, we're seeing, wearing a face mask at work, it's become a little, people see it as slightly stressful and inconvenience. Communicating to employees. One best practice we've noticed is that, taking that checklist and actually sending to employees to show what you're doing to ensure safety. So someone asked if we're able to send the links to the checklist via email, and I will send that. This probably is your first time on a call. I will send that link to the checklist with a recording of this session and all the other sessions and the resources mentioned by Matt in an email afterwards. So yes, you will get the checklist.
And one other item on the checklist and enforcement, because I don't think I went over this earlier, but obviously here at Boulder County Public Health, we're not going to be going out to every office and making sure they're going through all the steps of the checklist. We're hoping that everyone could take those checklists and use them as guidance. So when I say enforcement, we do receive a lot of complaints from a lot of different industries, including office industry, folks that haven't felt safe in their office because they haven't been following those checklist prompts. And so if we do receive a complaint, we follow up on all the complaints that we receive. And when we follow up, we're doing education. We're not going to try to come down too hard on anybody because obviously this is kind of unprecedented times and we're all in this together. But if we receive more than a couple of complaints, then we will be requiring or asking to see that checklist and making sure that people are abiding by the behaviors and the guidelines that are set forth.
And we've heard a little bit about, that idea, that fear of from employees about the safety measures you're doing. And one of the ways to communicate that is through the checklist. Another way is through the signage that you use throughout the office. In just a minute, I'll share that signage because it appears we have some new people on the call. So I'll share some of the signage that's available to you that you'll get links to. I'm going to close this poll. Thank you for doing this. And I'm going to launch the last one, which is what resources and support would be most helpful to your business at this time. With that, I'm going to ask you a question. Matt, I'm going to ask you a question. Are employees okay to only wear their masks while walking around the office and not wearing them when they're at their desk if others are more than 6 feet away?
Yeah, so that's one of those kind of judgment calls. The order states that if you cannot maintain a 6-foot distance from other people, you do need to be wearing that mask. And as I mentioned earlier, if you are in an office of 2 people or 3 people and you have your own offices and you're not within that 6-foot radius, you don't need to be wearing that mask. You should, of course, continue to wear it. When in doubt, wear the mask. Better safe than sorry is kind of what I always say. Continue to clean those high-touch surfaces. But again, if you're in an office, you're sitting at a desk and no one's you're really too close to you, then it's not really that necessary that you have it on. If you're going to be in a meeting or you're going to the break room and you're going to be passing by somebody in the hallway, that's certainly a time when you should have the mask on.
The only addition I have for that is, if your municipality has a more restrictive face covering order, then that would apply.
Yes, and that was just announced. Yeah, the last couple of days that I've seen, Louisville, Superior, Lafayette have announced stricter policies when frequenting a business, and a business means an office. It means a retail store. So in those instances, the stricter order does apply.
And we're working on pulling together guidance that clarifies, the state's order for the business sector, Boulder County's face covering order, as well as the local municipal orders. So it's, it's a little clearer for everyone, and you don't need to do your own detective work to see what applies in what situation.
That's going to be a valuable resource because we get a lot of questions about masks. Matt, could you address cubicles a little bit? If there's a height, what are some of the best practices with cubicles?
Yeah, so every workspace is a little different. Some cubicles go up, 5 feet. Other ones are kind of lower ones where you can see over the cubicles. It really depends on what your exact layout is. And if you have a specific circumstance, I'm happy to chat one-on-one with you to figure out what the best layout might be. But in my mind, if it's a general open office environment and there's cubicles, if you're at that 50% capacity, it might take a little bit of creativity to seat employees kind of at every other cubicle. If you have those higher cubicles that you probably, many of you maybe have, and they have that nice kind of plexiglass divide, like you've probably seen at a lot of retail stores, big plexiglass divides between the cashiers and the customers. Those are actually great for just kind of keeping, people's breath and droplets in. But generally, if you're in a big open space, you do want to maybe go every other cubicle to be safe.
Okay, so someone asked where they can find the restrictions in Louisville. And the state or the city website does have their mask order on their website. So we can try to find that and get that out. In addition, we'll be sending out the other checklist and requirements for office that were statewide. So you'll have your specific Louisville mask order, and then we'll send out the other parts of the office. So
And
there you go.
I just put an article from the Hometown Weekly that includes, if you scroll down in the body of that article, you have to go down a little bit, but it's underneath an ad. It has a link to the order. I couldn't find it on the city's page quickly, but you can access it there.
There you go. So thank you, Zach. So in the chat was a link to an article that does link, talk about the order for Louisville. Are there any other questions from individuals on the call? Office does seem to be a little bit more straightforward in a lot of cases than some of the other industries, but
Yeah, I
we
would
do have new
suggest,
people on each call. Yes?
Yeah, and if you were an office industry, I put the office hour sessions for the other industries as well, because there is a lot of overlap. Obviously, a lot of offices are tied in some way to a different sector. So feel free next week as well. We'll have any updates, obviously, to the May 25th update that Governor Polis will be providing. So anything that we learn from there and will apply to Boulder County, we'll be going over through each of those specific sectors. But yeah, the office industry will have another session next Thursday at this time.
All right. Well, thank you very much. Thank you to Matt and to Zach, Boulder County Public Health. It's almost 5 o'clock, and we appreciate the hours that you've put in. These industry office hours are very valuable to our businesses to be able to ask questions, provide feedback, and get the most updated information. And we thank you, the attendees, for coming, for listening, for trying to open your businesses in a safe manner. If you did get a link to this Zoom webinar, because it is a recurring event, you can use this link each week to log in, which is one of the questions that was asked, or you can re-register, but we will be sending that information out each week. The additional information, you get the recordings, and you can just keep logging into the same Zoom account unless something changes. Thank you to everybody on the call, and thank you, Matt and Zach, and we'll see you next week. Dude.